So we are starting now looking at the lower limb, and in class we discuss who would be beneficial from. So why don't we start really by looking at how we're setting up the client. So like everything, remember how we call this towel technique? T towel technique, yes. So you are taking the lower towel, good, preparing that. The lower towel you tuck under, good, and then the upper towel you leave this way. Now for the leg, if the camera can come to here, you would see what happened is that there is the bridge of the ankle is in the air, and what happened is that it does not allow the leg to be really comfortable. So because usually I would have the towel a lot bigger and wider, and I will put the two legs like that. So the toes, the big toe, should just touch the table. Now, because I work on one leg and this pillow is not wide enough, I will use only one. But in my practice, I will have really 3 or 4 pillows in different size, and it's very helpful to have this. Okay, so good. So we're starting again with a hold, yeah? You can do a nice hold here and here. And it is really a statement of intention. I'm going to work in this area. I'm going to just welcome and say hello to that area. Make it comfortable. Otherwise, you end up ripping the table and starting effleurage, and it's a bit too quickly sometimes, okay? Now, we need to talk about draping, how to use the towel nicely. So what you do is you take this towel and fold it a little bit, and then you taking one edge of the towel from where the hip is, and the other one where the ankle is. And what you do, you move the lower towel a bit more, like that. So the opposite leg is still fully covered to make it warm, and then the other leg is nicely exposed. You can tuck the towel underneath the opposite leg, just like that. Good? So the towel is nice, secure. If you want, you can also take the underwear and secure the towel this way. Yeah? So you start with nice effleurage. Nice effleurage. Again, really slow all the way down. Now the lower limb is quite long, so here you really need all the bending knees that you can have. You can do that a few times, and then the blood circulation of the limb drains back to the torso. So it is customary and needed to really work along this line. So you would not see me doing effleurage the opposite way. I don't think it's going to be detrimental, but it's a good practice. Okay? So now I would like to drain all this fluid, all the blood back into the heart, and then new fresh blood would come more with oxygen. So I would need to do it quite slowly. Good.
Wouldn't it be better if you could actually go up onto the glute?
You could. I'll show you after that how to do that. Good. So this is the drainage. Yeah, you can do that side by side, two hands.
How much pressure are you using?
Moderate.
Moderate.
Moderate, yeah?
Not just slightly more.
It's more than effleurage. Yeah? Because you really want to get the fluid, you know, up to the heart. Okay. Next one after is more the moving the tissue, the effleurage, yeah? And for that, I'll ask you to come closer. Now, in the limb, and that's correct also for the upper limb, muscle goes quite easily up and down. So, anyone know the name of this muscle?
Gastrocnemius.
Gastrocnemius. Don't worry if you don't, because we would learn them. And here are the hamstring. And they are working in up and down fashion. So this is where they start and this is where they end. So it's quite easy when we do some petrissage to do the following. First you can do more like picking up. So you're taking a whole muscle belly and then lifting it. Okay? You can do ringing. It's like squeezing it. One goes this way, the other one goes that way. It's like twisting the muscle. Yeah? So remember, the idea is stretching and moving the tissue. Good? Good. So we've done the lifting, we've done the ringing. Yeah? You can do a bit like figure of 8. It's very similar to ringing, but now you do it one hand at a time. Good. You can do that with your fingers closer to the Achilles tendon. So the idea here is try to separate the muscle from the bone with as much as you can. And you can go all the way to just below the knee. When you're feeling an area of tension, you can then change into working with your fingers. Why? It's more specific. You can do reinforced fingers. Now, should I work deeper or slower? Slower. Why?
Because you're deeper.
Because I can go deeper. Because if the surface contact is smaller, I can go deeper. Okay? Then you can do really the reinforced hand, like that. Even you can do it on the opposite side. Yeah? Void quite deeper. Good. Then you can really move the knee into this direction. And why? What I would like you to tell me in which position this muscle is freer. Look at this position like that. And look at this position.
No.
Okay. So do you see, when I do that, I put the muscle in a relaxed position and I can help it to relax a lot more. Yeah? You can help it, you assist it. It's like really rolling a dough. Yeah?
That looks like it feels really nice.
So you can imagine cyclists, how nice it would work on them. Runners, people who stand a lot, teachers of massage school. Yeah. So here you can really drain it, so you need to really go down a little bit. You have to be careful, especially if they have history of a sprained ankle, and not to push it too much. So maybe hold them here rather than here. Yeah? And then drain that.
What about women who wear like really high heels? Is that's good to know as well?
Absolutely, because they would have a really tight muscle, what you can do later on, we can do it right now, is to stretch it even more and then do that.
It's a lot of
Actually, it would feel like a stretch and massage.
When I want to stretch, I do this.
Okay, so we move onto the back of the knee. We're not touching yet. There are a lot of nerves and blood vessels there, so we leave it. And then you start working on the thigh. On the thigh is quite similar, because muscle are going up and down. There is a group of muscle here, group of muscle in the middle, and group of muscle or like tissue on the lateral side. Yeah? Now, what you have to remember around the thigh is the sensitivity of the inner thigh. So then you can go higher only on the lateral side. Yeah? So you can work on the thigh in the same, remember, picking up, doing some picking, trying to lift it, yeah, doing some ringing, yeah, even just separating the muscles. And you see that I use the lateral hand, the outer leg higher, yeah.
Sometimes called chocolate breaking.
Chocolate breaking, yes. It was a technique created by a Hungary therapist, probably. Yeah, one hand at a time. Yeah, but really nice. Lots of runners would have issue here, especially on the outside. So you can work on the outside. Yeah. Yeah, I think that once you do that, you can come back and cover the leg and go to the thigh. So once in a while you have what we call connected effleurage. So you did one side, one area with petrissage, then a whole effleurage. And then you went and do petrissage here and then connected effleurage. And then what's come is like a nice percussion. So as you remember, it's nice to do that with a towel again, so you can cover it and then start really slow. I like really the heel. It's quite really nice and relaxing around. Yeah. This is a more cupping technique. Once you finish, if you want to do another effleurage, you can really just come.
So we only just concentrate on one leg? We don't do the other?
Yes, now I would ask you to do one leg. Usually you will do two legs, but now it's really not a treatment, it's learning. So I would rather you learn. Good. And then you can do really nice hold. And these slow or almost like no movement point really change the concept of time for the client. Suddenly they are a bit lost, and it's good because they don't counting, they lost in timing, and that tends to be quite good. So how about just doing that? We will repeat, come back and do the buttock and more technique. Yeah. So let's just do this one side